Welcome to Breakout Session 11 on day 2 of the conference. This one will focus on enabling community participation and validation of digitally collected data through real-time feedback. We have two speakers from Oxfam this morning. Emily Tomkys, who is the ICT and Program Officer. She specializes in mobile data collection and coordinating Oxfam's work on how ICTs can be used within monitoring, evaluation, accountability, and learning, also abbreviated as MEAL in Oxfam. She's also exploring how to improve applying MEAL to projects that use ICTs to maximize organizational learning and program quality. With Emily speaking, I think, as a tag team, is Simone Lombardini. He's the Global Impact Evaluation Advisor with Oxfam. He provides more specialist advice on the tools, methods, and the process of undertaking rigorous impact evaluation on Oxfam's projects. So Simone's specialization is more on the evaluation side, and Emily's is more on the tech side of things. And they'll be speaking as a tag team for, I'd say, the next 40 minutes or so. After which I think we'll have at least 15 minutes for questions. And without further ado, I'll hand it over to Simone and Emily.
Thank you. So welcome everybody, and thank you for coming to our session. There are quite a competitiveness around the sessions, I think, this morning, so we appreciate you being here, and hopefully we can share with you our experience of kind of providing feedback to communities kind of during the evaluation process in the field. Feel free to kind of raise any questions, particularly on points of clarity throughout, if any points are unclear. Otherwise, we will try and present for about 40 minutes and then switch to questions at the end if our timing is right. We just received a great introduction of ourselves. So yeah, my role is looking at ICTs in program in specific relation to MEAL activities, monitoring, evaluation, accountability, and learning, and essentially looking at how ICTs can add value to our processes to improve our efficiency and cost effectiveness.
And as Maya already explained, I'm Simone Lombardini, and I'm more focused on the evaluation side, and Emily is more focused on the technology that is enabling us to conduct evaluations. Okay, thank you. So before we begin with the proper presentation, let me start giving you the objective of this presentation. So in Oxfam, we started back in 2015 in using mobile phones as a data collection tool, and now we are quite confident in using this technology for collecting our data. So we are now looking on how ICT can enrich our evaluation process, and one of the ways that we've been exploring is by sharing and using the data coming from our household surveys while the data collection process is still undertaking. And we believe that in sharing and using this data has a number of advantages. So the first one is creating greater engagement with communities by reducing the feeling of household surveys of being an extractive process. And secondly, to increase knowledge in two different ways. The first one, increasing knowledge for communities. There is a lot of thinking around how evaluations are designed to increase organizational knowledge, but an important component is also to enable communities to have greater knowledge. And the second one is for an evaluation perspective as well, to improve program understanding by enabling better integration between qualitative and quantitative methods. We will be arguing this by sharing our experience with the 3 case studies. 3 experiences where we try to apply these principles in 3 data collection process. And then we will be sharing some consideration and some learning that came as a result of this. So introduction and motivation. So let me give a brief introduction around the effectiveness reviews, which are these internal impact evaluations conducted by Oxfam that are conducted as a part of the global performance framework. And the idea is basically that every year, across the sample of all Oxfam projects, we randomly select a pool of mature projects where we are going to conduct an impact evaluation. And those projects that are implemented at the individual, household, and community level are mainly evaluated using quasi-experimental impact evaluation methods, which involves collecting large-scale household surveys. The first set of this impact evaluation was conducted in 2011, and since then we conducted more than 50 quasi-experimental impact evaluation in more than 30 different countries. And this also enabled us to invest quite significantly on measurement approaches, on particularly on how to measure women's empowerment and how to measure resilience, which are hard to measure concepts, but are crucial for the work we do. So this is the evaluation process, and I'm sure most of you working on evaluation are finding it extremely familiar. So we start with the project selection, which, as I said, is done randomly, and we conduct an evaluability assessment to assess whether it is possible to evaluate this particular project, and to define the level of implementation and the thematic area that for the project. We then decide, depending on these characteristics, on whether to use quasi-experimental impact evaluation tools or other non-counterfactual impact evaluation methods. And define the theory of change, design the questionnaire, conduct the sampling. And then when we move to data collection, then we go to the field, we train the enumerators, and we collect the data. At analysis stage, we mainly rely on econometric techniques, such as propensity score matching and multivariate regression analysis. And then report writing, we try to have a report which on one side is accessible for most of the people, but on the other side it contains the rigor required to defend the results. And then learning consideration and management response are linked together. Learning consideration is taking place with the program colleagues in discussing the results and trying to identify what these results means for in the context of the project. And then the management response is conducted at the country level in order to ensure learning that is taking place across projects in the same country. Back in 2015, well, before actually, back in 2014, when we started partnering with Emily's team in trying to improve the data collection process.
Yeah, so Simone's team approached us wanting to look at how we could potentially digitize the data collection. Traditionally, it was done on paper surveys, which the two main areas that were problematic to that was the time that it takes, as well as the quality of the data that they're receiving. So what we essentially wanted to do was reduce the time lag between the data collection and when the data was ready for analysis, which was typically 3 to 4 weeks, as well as improve the quality that we were receiving and therefore reduce data cleaning and how long that took. Now, at the time, Oxfam was piloting mobile data collection predominantly in its humanitarian monitoring and evaluation. For anyone that has tried to look at the sector with mobile data collection tools, it is huge, and lots of different tools have different benefits and pros and cons. So one of the first things we wanted to look at was which tool would be suitable for these effectiveness reviews. We were piloting between 10 and 15 different mobile data collection tools in different countries, but with a centralized global team that could potentially go anywhere, we needed a tool that could handle kind of any context. So we were looking at software that could handle any language so that the survey could be translated, and ideally that the application could also support that local language. Advanced survey design, the questionnaires were, long and complicated, and we wanted to look at trying embedding as much data quality checks actually in the survey at the point of collection as possible. So we wanted quite advanced survey design. We needed offline capabilities. no connectivity and everything would still work and we could still get the data and transfer everything, which isn't relevant to a lot of contexts that we work in, but given there is the potential for anywhere, we needed to ensure that the software could handle that. We also need strong data collection, strong data protection, which I'll touch on later, ensuring that it met Oxfam standards of data protection. And we wanted smooth integration into Starter, which was what these guys used to analyze their data. And we landed on Survey CTO. That was the software that we chose then and continue to use today. So in terms of the value add that we found of ICTs, we did 2 pilots initially. One in the Philippines in January, February 2015, and one almost immediately after in Thailand. And we were really looking at seeing what the value add was, where were the pros, where were the cons, and what kind of were the challenges that we found. So the first one was, of course, time. Like I said, we wanted to reduce the time it takes between data collection and when the data is ready for analysis. And what we found that time actually changed in 4 ways. It actually reduced the time that it took to conduct the interview. So enumerators were quicker and got quicker once they got more used to the software to do the interviews. Now you can see pros and cons to that. If we look at survey fatigue and how long the surveys are, that's a good thing that we're taking up less people's time. There's been arguments also that Oxfam is then having less interaction with community members and maybe that time is valuable. So there's 2 ways to see that. And the big one was the time to get the data. We had the data within hours. What we tended to do was collect the data offline, and every night, if there was connectivity, we would send the data on a nightly basis, ideally over Wi-Fi, just to keep costs down. So we had access to the data very, very quickly. The other was actually the time it took to clean the data. So I think it was last year or potentially the year before, one of the effectiveness reviews couldn't be done using digital for a multitude of reasons. And cleaning the data took 3 weeks. And that was the only one that was done on a paper process compared to the digital process. But as it has been mentioned in the data collection session yesterday by Richard, is that, of course, you increase the amount of time that it takes to set up. You need a paper survey, you have to translate that and put it into a digital system, and there's extra training that's involved. So there is an initial investment up front on time. In terms of data accuracy, fewer people were interacting with the data. Yeah, we didn't have data entry people. It was at the point of collection, and then we had it in the back end of the system. So the number of kind of input errors were low to null. In terms of the ensuring that we improve the quality at the point of collection, we introduced kind of automatic checks. So, obviously there's skip logic. Nobody could answer a question they're not supposed to answer. But also, we embedded calculations within. So an example is when we were looking at the percentage of income from different sources, there were 5 different sources, the last one being other, that should, of course, capture everything. We wanted that to add up to 100%. And if it didn't, it would flag up that this currently has adds up to 115%, it needs to add up to 100%, please go back and change it. And you can either force them to go back and change it, which we only did since we've actually felt more confident in our use, or they can continue and we would speak to them later, essentially. So having things like that, we also could look at, and what we've been exploring more is time. So how long has someone actually spent getting consent? Is it 2 seconds? Because if so, that's not informed consent. So we can actually track and put timing in to actually see how long people are spending on different sections. And in particular, we've really played around with consent because we want that to be asked in an appropriate manner. And previously, of course, the way that paper surveys were looked at was you would kind of randomly select some paper surveys and go through them to check quality. What we could now do was nightly checks on aggregated data and check immediately kind of outliers and speak to enumerators there to improve the quality. Cost-wise, what we found actually that when you're not buying the hardware, costs reduce. Because we were using local consultants to help us with these effectiveness reviews. You're not paying them for the 3-4 weeks of data entry, as well as the people who are having to do that. So the cost of the software was minimal, and as long as hardware was actually already bought, the costs were reduced by 15% of each effectiveness review, of each study. And in terms of the hardware, Oxfam, M&E, digital M&E is active in over 2/3 of the countries that we work in. So many countries already have a bank of hardware that we can essentially just borrow. And when that isn't the case, we look at working with consultants where they have their own hardware and we can just tap into what they already have. And then in terms of security, fewer people have access to the data. Our data is stored securely, and with Survey CTO in particular, if you are doing quite personalized and sensitive data collection, you can kind of doubly encrypt your surveys where only people with a private decryption key have access to it. Never lose that key, because then you can't access your data. So there are chances we've had some hair-raising moments when we've struggled to find where we've saved it. But those kind of setups, we obviously ensure that the hardware is all encrypted, and we set it up in a certain way to maximize kind of battery life. We've got a mobile device management system, and we actually use a free Android app called Kids Place, which was designed for parents to be able to control what children can do on their phone. And we've used it for controlling what enumerators can do on the phone and ensuring that photographs and selfies are not taken and the battery is just wasted by trying to download things that we don't want them to download.
So there are clear advantages of using ICTs, and what Emily mentioned are the most commonly known advantages of using ICT. However, we believe that there were still some issues in the way household surveys are conducted. And the first issue we believe is quite important is the recognition that household surveys can be long and tedious for people answering those questionnaires. And the fact that the response might have little connection and motivation in taking part of the survey can also have can produce some then issues around response rate and then representativeness of the study. So having big proportion of our sample that is refusing in taking part of these surveys can produce a problem, can have a problem in our study. And the second one is that these research and evaluations are conducted with assumptions that respondents dedicate time to provide detailed information about their lives in order to then enable researchers or evaluators to then answer research and evaluation questions. However, do we know if these evaluation and research questions are relevant for the communities we are working with? And how often are these results coming from this evaluation are then shared back in the regional communities that contributed in providing this information? And if so, after how long is this happening? So we know that ICT is enabling us to process the data that we collect immediately, contrary to paper version where you collect the data, then you go back to the city and you have a data entry process. With ICT, this can be done immediately as long as you have a connection to a Wi-Fi or to a network in order to connect the data to a server. And we argue that by using this data and by sharing this data during the data collection process that is taking place in a field has the potential to increase accountability and participation, as well as knowledge and understanding. Accountability and participation by reducing the feeling of a household survey being an extractive process and sharing summary statistics into the communities that we've been surveying. And to increase knowledge and understanding by enabling this community, empowering these communities and make use of this data and act upon them, as well as for an evaluation perspective to make a better integration between qualitative and quantitative data. For example, by sharing survey data into focus groups or to use other evaluation tools. So, as I said, we will be presenting 3 showcases where we attempted to to do this. We did it in Thailand, Armenia, and Zambia. Let me say these are small-scale experiments. We are still trying to understand ourselves, what is the way forward. But these are the examples. And as it was mentioned before, we also learn from failure. So we will try to be as honest as possible and identify where we can improve. So the first example is Thailand, back in 2014. This was our first attempt to share data while data collection was taking place. And it was incidentally the first time, not the second time, we were using digital data collection. So it was quite an hectic fieldwork as well. The project we were evaluating was a resilience-related project, working with farmers in improving their level of resilience in producing rice and protecting them from weather-related shocks. And the objective of this exercise was to increase participation, transparency, and accountability for the local agricultural groups that the project was working with, as well as to increase knowledge from an evaluation perspective around some of the assumptions we made during the questionnaire design. So during the questionnaire design, we worked together with our colleagues, with our program colleagues, as well as with some representatives coming from these agricultural groups, in order to identify some of the indicators that we were collecting that could have had a use also for the communities we were working with. And this being a project related to resilience and rice production, they identified three main categories around farming activities, water storage capacity, and weather forecast that they wanted to be shared back during the socialization process. So what happened is that we continue as usual in having a team of enumerators that were trained to conduct household surveys. And on a daily basis, these data were uploaded on a server and stored there. But every time a particular geographical area was surveyed, then the local consultant that was in charge of the data collection process then was getting back in touch with me that I was going to download the data, process the information that were identified as relevant, and I was going to send back all the graphs and summary statistics to the consultant that then was going to present these results into the agricultural groups. So it was quite easy, but at the same time it required a bit of organization between me and the consultant, a bit mechanic. What we found is that, well, on top of greater engagement with these agricultural groups that otherwise they would have not had any input from our side, we also identified some of the data we were collected had some potential question marks around especially there was a question that was looking at registration to a particular farming certificate. And we found out through this process that registration process wasn't as straightforward as we thought. It actually required a lot of time for a farmer to get that certificate, and a lot of them were in the process of getting it, but they actually didn't get it yet. So we identified as a potential, information that was potentially biased through this process. And this was a piece of information that otherwise we would not have been able to capture. The second example is the following year in Armenia. And here we were conducting an evaluation on a women's empowerment project, working in some rural communities. And the objective for this exercise was slightly different from the year before in Thailand. So here we wanted to make a better integration between the qualitative and quantitative data that we were collecting. And therefore, we wanted to have a better understanding around the program. And we had two different local teams that were working on that. The usual quantitative team composed by enumerators. And then we had a qualitative research team that was using the real-time survey data to then conduct think aloud interviews to a random subsample of surveyed respondents. Think aloud interviews are basically a qualitative technique that consists in using some of the responses coming from the household surveys and to use it in a more qualitative setting in order to try to understand the whys and the hows respondents responded in a particular way. We investigated a number of thematic areas related to women's empowerment, in particular around contribution to household income, contribution to communities, social communities, and then influencing in community groups. And this is an example of how, as you can see on the bottom, these are some of the data that were coming in real time from the household surveys, then were used by the qualitative research team in trying to understand the why and the how this change referred to household income was taking place. So the way it was happening is, for example, on one day, the household survey was conducted, and then after 1 or 2 days, the qualitative team was then following up with some of the respondents to investigate these questions. So it was done not on the same day, but within the same data collection process. Of course.
I just want to remind the audience, if you have a question, please turn on the mic so everyone can hear the question.
So I just have a follow-up question as well. So when you ask it in the second round, it's mainly like a perception question, like agree or not agree. So, or like you want to dig further in the second?
So these are women's empowerment questions. So most of them are perception questions, also in the household survey. What we wanted to do with the Think Aloud interview is to understand the why and the how respondents responded in a certain way. So if in the household survey you're asking for a certain perception, with the Think Aloud interview you're trying to understand the reasoning behind that answer. And having almost in real time the way that the respondent responded in the household surveys then is making it easier and smoother into going back in the, yeah. Okay. And then the third example is Zambia this year. This was a resilience project.
Yeah, so Zambia was kind of our latest pilot in this process, and the focus here was to look at improving the knowledge and understanding of both the communities, but also the disaster management committee that was active in the communities, and looking at increasing participation and accountability. So it was essentially split in two in terms of feeding back the results. So one was a presentation that was just done through PowerPoint in terms of we identified the results that were and the indicators that were most relevant to the Disaster Management Committee and presented them back to them separately. And this was done by our research assistant, and it was looking at identifying the knowledge and confidence level of the community in the Disaster Management Committee and their role within it. So to look at how that perception could look at improving the work that the Disaster Management Committee does. And the second part was, of course, socializing the results back to the communities themselves. So this was in groups ranging to 20 to 50. We always looked at being as inclusive as possible, ensuring that we had people ranging from kind of backgrounds and gender and age. And we did this in 3 sites, so 2 intervention sites and 1 control site. And we really had to think about how we should present the results back in a way that was understanding and could be understood and meaningful to the communities themselves. So actually what we did was present it back using kind of sticks and cassava leaves as a way to try and explain the math and the percentages behind the results that we were presenting. So we didn't use technology to do this at all, and it wouldn't have been appropriate. And the type of data that was presented back were things on agricultural techniques, loss of harvest, any innovation activities that were taking place or had taken place, and anything in relation to the disaster management committee, so that, again, they knew how they could target the committee to improve the way things were run. And what we found was some of the data was a surprise to the communities, particularly around agricultural techniques and innovation techniques, which were then actually explained to them, and that they then found helpful and knew who they could talk to go and learn about that technique, but also it was explained so that they could, to help them understand why these might be helpful to them. And essentially results were reflected and discussed, kind of the findings together, and the feedback that we got was people felt included, and they found the information useful, and it gave them findings that perhaps they wouldn't realize or observe normally. And the quote there is, again, showing how an innovation in agricultural technique was used in a nearby village, and that people then knew that they could go and speak to them and learn about it kind of together. Okay, so just to go through some considerations, and we'll tackle the challenges at this point as well. One of the first questions we wanted to tackle was in terms of cost, the way that's perceived. So what we wanted to do was actually, we managed, as I mentioned before, to save about 15% of the evaluation's cost by switching to digital if we didn't have to buy hardware. So part of this process was looking at how we can actually use those time and resources saved into improving the process. So not to save money, but to make the evaluation more in-depth and including different areas. So what we found was that in terms of the socialization and feeding back to communities and relevant kind of committees was that it increased the cost back up by about 10 to 15%. So essentially you could look at it as replacing each other. And obviously the costs are pretty obvious. It was things like the added consultant's time or Oxfam's time, thinking about preparing, thinking about how is the best way to actually present the results back and ensuring that those who we want to be there are there. Any local travel costs and things like providing refreshments and kind of the normal when it comes to meeting with communities.
So we thought that it would have been useful to share also some of the key questions that we are now going through, now that we are thinking in doing another of these exercises back again in Zambia in a data collection for an impact evaluation this summer. So the first thing that we asked ourselves is to define with whom we want to communicate to. And this is really is defined by another question, which is what is the objective of this exercise? As we saw, there were different objectives we wanted to achieve in Thailand, in Armenia, and in Zambia. And these objectives then influenced the people we wanted to talk to. And how to communicate. So we saw how, for example, in Zambia, cassava and leaves were used to communicate certain mathematical concepts, while in Thailand we used already graphs and numbers. So being very clear and explicit on what is your audience and how to make it more accessible, the information you are conveying. And then there are some questions around, well, what kind of information we want to present. So there are some inherent risks every time you are sharing data. sharing survey data that is coming from a questionnaire. And we believe that sensitive information should not be shared, such as, well, I wouldn't go there into defining what is a sensitive information. Maybe we can discuss it later. And also information shouldn't be presented in a way that then individuals' data points, individual households can then be traced. And then there is a need to define and to identify what informations are useful. So this exercise at the end of the day needs to be a useful exercise. So there is a need to work together with the communities we will be interviewing to define what they will find most useful.
Yeah, and just touching on kind of the data protection risks of sharing data, for those that for those that don't know, Oxfam has really been exploring this, particularly over the past year to 2 years, and we've just released a responsible data, a few years ago we released a responsible data policy. It's kind of a rights-based policy of looking at the rights and values behind the data, what we need to do legally, but also what we morally and ethically should do when we're handling people's data. And for anyone interested, we've just released a training pack to improve kind of staff and other agencies' knowledge of what responsible data is and what it means in program context, so that we're ensuring that we are protecting the people that we're working with and their data. So if anybody wants to have a look at this, feel free to come and speak to me afterwards. But in terms of the challenges, one of the kind of most obvious ones is that obviously not all household surveys would be conducive for digital technology. We like it. We've had fantastic experience of it, and we've scaled it and successfully embedded it into lots of our M&E practices, including this one. But there will be contexts and countries where it wouldn't be appropriate, and we very much realize that. And in particularly when it comes to the security situation, and where technology, the biggest barrier we found is where technology actually just isn't trusted. You know, people are really wary of it. They know what it is, and it's actually seen as something that's scary, because are you going to share it with the government? And no matter how much you can try and introduce it and talk about that, it still wouldn't make people feel at ease. So what we've actually done, in part because of one of the learnings of the first pilot, which was the Philippines in Mindanao, we always have paper backups. So as part of our budgeting process, we look at budgeting for 10% will be collected via paper, ensuring that enumerators have a few or have access to print a few if they need it. Because in the Philippines, the security context changed actually during the data collection process, and it was deemed in certain villages that it would actually be unsafe for enumerators to be using devices. So we're always ensuring that if we need to, we can switch if the security situation changes, but also that people have the right to choose. Okay, maybe they want to give their consent, but they don't want to be kind of have it collected digitally. That hasn't happened very often, but at least we have that option if people want it. And of course, it's a backup for us if the technology did anything crazy. And obviously, the other challenge that we mentioned is actually deciding what data we should kind of present back to communities. Obviously, we want it to be as valuable for them as well as for us as possible, but looking at that data protection risk and really ensuring that we're not putting anyone in that community at risk or nearby communities at risk, and that we won't embarrass or kind of embarrass anyone that has actually given us their data, because we need to keep that trust between us and the communities we're working with. And then the other one was on inclusivity of feeding back the results. We want to ensure that people are present who want to be present, that it's an accessible environment, and really that's about liaising with the communities themselves and working out where is deemed a kind of accessible place for everybody in the community to come to. Part of something that I've actually thought of is a lot of the feedback, particularly in Zambia, was obviously the intervention wasn't enough. We still need support, and of course you had the control group who hadn't received anything. And does every time that we're looking at kind of surveying people, that raises an expectation. So does feeding back results also increase that expectation that people might have of our organization? And I think that's something that we need to be wary of and ensure we're as open and honest as possible, that this isn't going to ensure that more support will come. It's about empowering them to own their own data and to use their data that they have given us in a way that could be beneficial towards them.
Then another challenge is around capacity. So this is a relatively uncommon practice. So you need to make sure that the people you're working with and are sharing this data have the right skill in order to do that. And so far we've been quite opportunistic in actually trying these exercises where we felt the people we were working with had those skills. If not, then there is a question around how to build a system, a process where everyone can follow and then meet the conduct this exercise in a way that we consider satisfactory. Then another issue is around the coordination between the different people involved, and to ensure that the informations that are coming out of this socialization exercise are captured in a way that it can influence the evaluation. So whoever is conducting the data analysis should have access of whatever is coming out of these socialization exercises. So in terms of going forward, in terms of, I'm speaking for the impact evaluation team in Oxfam Great Britain, and the idea is that all the household surveys should be continued done using digital devices. And what we would like to achieve in the next coming years is to systematize this socialization process. As I said, so far we've done it more in an opportunistic way. When there was the scope for doing it, we've done it. The idea is to build a procedure and systems to make it easier for the evaluator in charge of this evaluation to also include this component. And I know the technology is also helping us in avoiding to have more interactions between the field team and the evaluator that has access to the data, so it can be more fluid and more interconnected, but we still need to explore how this practically works. And then in terms of immediate action point, we are hoping to test again and to try to improve what we presented so far in an impact evaluation that will take place at the end of the summer this year in Zambia. Again, they were very happy and positive about this experience. So we're trying to do another exercise like this at the end of the summer.
Okay, great. So just to let you know that firstly, the effectiveness reviews are all published on Oxfam's policy and practice website. We were hoping that the Zambia example, we could kind of time it well, but that's still yet to be released. But the previous ones are all available online. And Simone and I wrote a paper back in 2015 about us going digital. So if you are interested in the digital side and converting your evaluations, it could be a paper that's of interest. And we also have a blog called Real Geek, and we try to blog as often as possible. Obviously, like all of these things, it comes in waves. And it's an area that kind of Oxfam's, particularly program quality and monitoring evaluation and ICT and program staff, kind of just put out thoughts on things like research, measurement and evaluation, and some of the trying to be as brutally honest as possible on some of the challenges that we're tackling and putting out those kind of ideas. So feel free to take a look at that.
And yeah, to conclude, so basically I want to emphasize back again that this is a really simple and easy idea. It's nothing that is completely changing the way we do. It's just trying to be more aware of the limitations and of the challenges of conducting household surveys, and trying to be more mindful on what ICT can enable us. We're still exploring ourselves how to make it work. So we're not here to say what is the best way. And actually, we are encouraging anyone that has experience in doing it to share their experience as well, as we're still in the process of, make it work for ourselves. But otherwise, thank you very much for listening.
Okay, thank you, Simone and Emily. I think we have just over 10 minutes for questions. And I forgot to introduce myself. I'm Maya Vijayaraghavan from the Asian Development Bank. I'm with the evaluation unit, and some of the work that I do is actually impact evaluation, which is, I think, one reason I was asked to rapporteur this session. But anyway, with that, I'll open the floor to questions. And just a reminder, please turn the mics on so the entire audience can hear your question. Thank you.
Thank you. My name is Andrea Cook from World Food Programme. I'm the Director of Evaluation for WFP. I have two questions. The first is understanding scale. I have the feeling that these are quite sort of focused community level interventions, and it'd be good to have some reflections on scale, both for the data collection, but also for the feedback at community level, sort of in terms of going to scale. So that's my first area. I'd really appreciate your reflections. The second is about the feasibility of doing this in more insecure environments. And you said a little bit about that, but it would be good to hear a little bit more about sort of some of the safety and security dimensions there. Thank you.
Yeah, sure.
We will take a couple more questions.
My first question, actually, Andrea asked. I'm Diana Cartier from IOM, also working in monitoring and evaluation in our evaluation department at headquarters. Emily, you mentioned that you've used this also in other elements of your meal efforts, and I was wondering if you could touch upon that, how you might have incorporated another way, particularly the socialization, but of course the household surveys and the digital elements as well. Thank you.
Let's take another one.
Maybe we'll get one more question. Yes, ma'am.
Thank you. My name is Elizabeth Sentwala, working with IFAD at the Gender Desk. I was very interested to hear about your evaluation on the women's empowerment, and so I have two questions on that. The first one is on the women's empowerment, I think in Thailand that you evaluated. Was it?
It was Armenia.
Oh yes, Armenia. So you were getting also the perspectives of the women and whether they were empowered or not. And then I was wondering if you had an option or a leeway to find out the perspectives of the men on women's empowerment. And in the other two cases that you've presented, then were you also able to track women's empowerment? Because you know, this is an issue which is in there, whether or not you are tracking it, you know, whether or not it's a women's empowerment project or not. These are issues inherent in there. Thank you.
Okay, I start. So thank you. So Andrea, on the scale, yeah, you're absolutely right. These are quite small exercise, very small exercise. In terms of sample size, we're talking about roughly from 600, 700, 800 household surveys or individual surveys. And in terms of scale for the socialization exercise as well, it was quite small. So we're talking about for, I think Thailand was, I mean, could be wrong, but 6, that bulk of scale. And for Zambia, it was even less, it was about 4, I think. And the idea was to try to cluster by a regional area, so having one socialization exercise and having the different communities representative of different communities to merge together. In terms of the question for feasibility and in insecurity environment, Well, I can say that I completely agree. It's a real challenge, and yeah, it's probably something I would think it twice before suggesting for this approach in that context. I don't know. You have more experience in security environment.
Yeah. So in terms of using ICTs, we are doing mobile data collection and using technology in our ARMENIA in Syria, Iraq, Jordan, Lebanon, Nepal after the earthquake, a variety of humanitarian settings. There's been even we've done a few things in Somalia. So I think and DRC. So a lot of places we are using technology. I think in terms of other examples that you mentioned with socializing results, one of the first areas that we looked at both doing digital and socializing results was a protection study, a relocation study following Typhoon Haiyan in the Philippines. And we introduced using kind of technology, and yeah, it was immediately apparent to us that we could of course use the time and the resources saved into adding on to the study to feedback to results. So they were more focus group led, so it was more building on the why and looking at we have access to this data now, right, let's really dive into it and look at what it means. It was probably more on that and verifying results and adding to our own study more than actually looking at giving the results back and empowering communities in that sense. So I think we've slightly come a long way in the potential of what that can do. But I don't think socializing the results happens as much as it should do in humanitarian settings. I don't know the reason for that, but I don't think it's a natural thought that comes into people's head. Often it's, oh, we can save money and time and we've got all these other things to do. Let's get the baseline done and move on. But using ICTs is happening in a whole array of contexts, insecure and fragile, and I think there are extra considerations that you need to take into account in terms of the security, disabling location settings on devices, ensuring that photos aren't taken, and there are a number of things that we need to think through, but I think as long as you are looking at the risk versus, as Linda mentioned, versus the value that could be gained, it's just about juggling that and making sure that you're not putting people at risk. Do you want to take the we?
You want to take Diana's?
I've done
Oh, sorry,
so
okay,
do you want to
then
do the
both.
woman?
So, Elizabeth, yeah, you are absolutely right in the sense. So for these effectiveness reviews, one of the thematic area, it was explicitly women's empowerment. So when the project was selected under women's empowerment, we were looking at, well, we used a multidimensional indicator to capture women's empowerment that goes through different dimensions, and we invested quite a lot in how to define and measure these hard to measure concepts. We are very well aware that, or at least the way this index works is that it has different dimensions, and one of the dimensions is the environment where these women lived in, and the perspective where coming from men is extremely important. Say that for this evaluation there are huge trade-offs and there are very hard decisions that we need to take. So when we are trying to capture perceptions for men, it's still going through what women perceive that men think. So yeah, I know it's not great, but having to interview also men, it would have meant either we had to have both men and women at the same time, creating a lot of issues around, well, are women then really free to express what they really believe there is a man, or doubling the sample size, also having men, but then had a huge impact on the budget and the sample size for then doing econometric analysis. So I don't know if it's the best approach. This is the decision we take to have that perception coming from household surveys through women. Say that when we have a qualitative component, then in that case we are proactively trying to get also men into to get perceptions coming from men with their qualitative components.
And just quickly to add actually to Diana's question, one area that we have found in development programs is multi-country programs where the use of ICTs really add value. So lots of our multi-country programs, including We Care, which is a women's empowerment program that does interview both men and women, having the kind of one survey for all the countries, and then they split off and have their own kind of country-specific questions, but you've got the global indicators being measured together. So that's one area where ICTs, I think, have really added value to multi-country program M&E.
Perhaps we could switch to this half of the room and take a couple of questions. Yes, ma'am.
Thank you. I'm Arianti. I work as an evaluator at Results in Health in the Netherlands. I have two questions. The title of the session also said that it's enabling community participation. Can you maybe explain in which part was the community participation in the presentation? And number two, I'm just curious, if you do this feedback to the community, what is the lead time that you use? Do you do 2 visits? So after the collection and you analyze and then you come back, or you try to do it all in 1 visit? Thank you.
Hi, hello, my name is Paul Jasper. I work at Oxford Policy Management. At my company, we have a bit of experience using mobile phone or mobile technology to collect survey data as well. And my question really to you is about how, whether you have experience and whether you could share that, how you can use metadata that comes out of this. You briefly mentioned that to ensure data quality, and whether you've experience of doing that sort of on the go while the survey is being implemented, which is something that I find very interesting and probably very useful to improve data quality collected.
Sorry, didn't get.
Apologies. So my question is, how can we implement the kind of same concepts that you have when we actually are not sending enumerators to interact with people directly, but rather using remote methods, let's say, either mobile phones or WhatsApp, Facebook, etc.
And your name is?
Oh, apologies. So my name is Gaurav Singhal. I'm a data scientist at WFP.
Yeah, we don't have, yeah.
We're running out of time, but maybe we'll have Simone and Emily respond, and then perhaps after the session you can follow up with them.
Okay. Okay. So very quickly, because I'm conscious of time. So Ariante, in terms of timing and visit, so one of the beauty of ICT is that it is enabling to do this process on the go. That's why the real-time component. So the idea is to have the research team and the data collection team that are there once, and we can process all the information at once. So there is no need to double the effort of transport, movements, and so on. And the community participation component, it comes into the fact that the information that is coming out of this dissemination process are then, the idea is that this information are then used to inform the evaluation itself, so they can participate in shaping these points. And I didn't get into thorough, very detailed way, but for example, in Zambia, there were a lot of issues around measuring resilience, which is a hard to measure concept, and in order to design a questionnaire and indicators that are measuring resilience, there are a lot of components that well, a lot of decisions that need to be taken into account. And a good way of, for doing that, to test that these assumptions are correct, is then by testing them during these exercises. Paul, in terms of metadata and quality, I'm not sure they're really metadata in a sense. What we use are quality checks around the timing, something that mentioned Emily. We've done few few exercises around like randomizing some questions, and see how this random variation is then creating different answers. And but in terms of the metadata itself, yeah, I would be curious to know what OPM has been doing on that component.
Yeah, and just to take the last point, it's a really good point, and it's not something that we have done a lot of. It's something that we're thinking about. But I think if you are in a remote setting and you're using technology as a way to interact in some form with communities, then one of the best ways, if that works, which is always questionable, I would argue that you could feedback results in that same manner. So I mean, you've got data protection concerns, especially with SMS, given it's the most kind of open technology that there is. So being careful, but you know, in Somalia, we've had a great kind of public health promotion program using text messaging, and even though, you know, there's such an array of things to think about when you're designing this in terms of literacy, in terms of power dynamics, and who has access to technology and who doesn't, because that's often controlled. Also, the fact that you don't know who's responding. For all you know, it could be a 12-year-old kid playing with his dad's phone, you know? So I think that there are so many things to think about, but if you are successfully using technology as part of your program, a way that you can ensure socialization of results, if that interaction is working, is to use the same technology that you know works and that people have access to.
So would you just communicate back the results, or what would be like the kind of effective message that you would provide based off the, you know, the results you get?
It would depend so much. I know that that's quite useless, but as we said, we need to think about things like, of course, it's not just who in the data that you're kind of responding to. It would also be, you know, the method of which you're responding would need to take into consideration. So SMS, you're completely constrained because of the length of messaging. Similar with, well, less so with WhatsApp, but Facebook groups, we've done some interaction with Facebook groups together, looking at, you know, them taking photographs of kind of what they would think of is significant change, and then writing stories, and then community interacting with it in a way of making that. So it would depend in terms of access, language, literacy, for me to give you a set answer, but it would need to be thought through, and it would need to be concise, and we'd need to know that the people that we want to have access to it would have access to it and would also understand it.
I think we should close now a little past the 12:30 hour. Thank you, Simone and Emily, and if anyone has additional questions, I'm sure they'll be around for the rest of the day, so you can follow up with them. And I don't want to spend too much time, I think, summarizing. They've done a very good job walking you through the whole process of picking a tool, using it within the community, and feeding it back, so I won't waste any more time. I think it's past your lunchtime, so thank you very much.
Thank you.